Good morning. We were having a little joke just in terms of the two people that I'm very pleased to be with today as we share with you thoughts about our mobile strategy for vaccination. That to my immediate right is Dr. Eileen de Villa, of course, our Chief Medical Officer of Health for the City of Toronto, and it's my pleasure to introduce to my far right councillor Joe Cressy, the Chair of the Board of Health, who will share some remarks each with you this morning. We have had tremendous success. It's a source, really, it can be a source of great pride to the city, how much success we've had getting people vaccinated. But now, as we move into the fall and face the fourth wave and the Delta variant, we know that we have much more work to do. And in some respects, it becomes even more difficult and challenging work to build on that success and to get even more people vaccinated. This will be crucial to all of us staying healthy and protecting the progress that we have made and keeping schools and other places that we go safe and keeping them open. Today I'm pleased to announce that the city is moving forward with its expansion of Team Toronto's mobile strategy. This data-driven approach will continue to bring vaccines to residents in areas and settings that have low vaccination coverage or a high risk of contracting COVID-19 or both. The expansion will provide Toronto Public Health the capacity to host up to 200 mobile clinics each week, in addition to the clinics currently run by Team Toronto and healthcare partners. This, of course, is made possible by the fact that we have reduced to some extent the number of permanent mass vaccination clinics operated by the city and redeployed those resources to this mobile effort. The clinics are part of the new micro-targeted approach to get the vaccines to areas with low vaccine uptake and make sure everyone in all parts of our city is vaccinated, and that we make maximum effort to inform, to persuade, to make accessible, to do whatever we have to do to bring resources to people who have thus far been unable to get vaccinated. So the mobile clinics will focus on settings where residents work or study or play, such as workplaces or schools, post-secondary education, childcare, and places of worship. And you've seen examples of each of those, but you'll now see more examples of those kinds of very local settings in which people are comfortable and regularly attend just as part of their routines. We will have a presence in locations and areas where people commonly go, including TTC stations. Again, we were at one last week. They're happening again this week, and there will be more of those going forward. But we'll also be in grocery stores, in parks, at sporting venues and recreational facilities and shopping malls. And again, all have proven to be successful because that's where people are. And sometimes they'll just happen by, as Dr. de Villa and I saw last week, they'll just happen by because they're out picking something up at the store and see the clinic and come in and get vaccinated. This is a good thing. Roughly half the vaccinations administered at our clinics and TTC stations last week were first doses, which means there's a need out there for these types of clinics for people who just haven't gone even to get that first dose, and for whatever reason they feel comfortable going to a place that is very mobile and perhaps in a place where you wouldn't expect to find it. And we've got to make sure that those people who haven't yet had an opportunity to get that first dose or second dose have that opportunity on a basis that is as easy and accessible as it possibly can be. We have shown with these different, I don't want to call them experiments, these different initiatives with subway stations and malls and schools and places of worship, that if you put these clinics in the right spot at the right time, people, many for the first time, will come out to get vaccinated. And that is why we're expanding precisely this effort in the coming days. We'll have hyper-local clinics in targeted neighborhoods with lower vaccine uptake. Starting this week, neighborhoods with high numbers of unvaccinated people in 3 specific age groups, namely young people 12 to 17, people ages 25 to 49, and residents 65 and older, will be the focus of expanded clinics and outreach. Toronto Public Health is working to get as many micro-clinics as possible up and running every day in the following 12 neighborhoods. We know public health does, because of careful data collection and management and analysis. We know the top 5 neighborhoods, for example, with the highest number of unvaccinated residents aged 25 to 49. They are for your interest because some of you may live in them or know people who do. They are the waterfront communities, Willowdale East, Islington City Centre West, Church Yonge Corridor, and Mimico. So you can see it spread across the city, the 25 to 49 under-vaccinated populations. The top 5 neighborhoods, for example, with the highest number of kids who are eligible but haven't yet been vaccinated are Mount Olive, Silverstone, Jamestown, Engle Mount Lawrence, Woburn, Downsview Roding CFB, and Glenfield Jane Heights. And you can see there's a concentration there more to the west and to the north in the city. But we know those are the places where kids have not yet been vaccinated. And we also know the 5 neighborhoods with the highest number of unvaccinated residents 65 and older. And they are Willowdale East, Islington City Centre West, Lamoureux, Woburn, and West Humber, Clareview. And so they are, Clareville rather, they are spread in different parts of the city. But that is how detailed this data-driven approach is, and that is what we're using to try and drive up the rates of vaccination. I also continue to encourage employers to reach out to Toronto Public Health about hosting an on-site vaccination clinic for their workers. Workplaces can apply through the City of Toronto's website. They have been able to do so for some time. And Toronto Public Health will follow up very shortly after such an application to discuss eligibility. It is important for businesses to follow up and take advantage of this opportunity. It is meant to accompany and to assist with vaccination policies many of those very same companies have already put in place for their employees to keep these workplaces safe and healthy and minimize disruption for everyone. You can imagine the convenience and how much it will encourage people to get vaccinated from among those employee groups if you have a clinic right at the workplace. And to be frank, it's been sometimes challenging for us to get people to respond positively, even when they have made an inquiry of us to actually schedule the clinic and make it happen. And I'm going to be personally reaching out to business leaders to encourage them to take advantage of this, because I think it too will help. Beyond workplaces, other community settings can also request a mobile vaccine clinic. So if there's some kind of a place where you know people come together in some of these areas, especially of under vaccination, you too can ask Toronto Public Health if they would have a mobile clinic in that location. We want to hear from property managers. We want to hear from managers of apartments or condominium buildings, community and social service agencies, and religious organizations. Those were all organizations where people gather together, and where perhaps a clinic there in a familiar setting like that might be one that will work very well. And we just encourage you to ask. Don't assume that it's not a possibility, because it very much is. We know that the vaccines are our best defense against COVID-19 and the Delta variant, and the best way out of this pandemic. How do we know that? Again, there is strong evidence to tell us this is the case. What could be more convincing than, first, the fact that 4.5 million doses of the vaccines have been administered in Toronto, and that, second, following on that directly, since May the 1st, in this city, the City of Toronto, 98.7% of hospitalized COVID-19 cases with known vaccination status were people who were not fully vaccinated. So if you ended up in the hospital, 98.7% of the time you were also someone who was not fully vaccinated. And it shows you the beneficial effects of these vaccines. Fully vaccinated people have greater protection against COVID-19 than those who are not. So please do not wait to get vaccinated. A look at what is happening elsewhere would tell us that caution is still the order of the day when it comes to battling the Delta variant in particular. And we want schools and other important places that are important to the lives of people in the City of Toronto to stay healthy and to stay open. That is the objective, to make sure that people stay healthy, but also to make sure that we can stay open as a society. Notwithstanding the progress that we have made, the pandemic is not over, and we will have our challenges to deal with for a while yet. And so please, I am asking you, as will Dr. de Villa, as will councillor Cressy, please get vaccinated. And if you are vaccinated, fully vaccinated, please keep an eye out for someone who's not that you know, and encourage them to get fully vaccinated. I would now like to ask Dr. de Villa to speak about the mobile strategy and why it is so important for people to get vaccinated.
Thank you, Mr. Mayor, and good morning. We all share the desire for the pandemic to end. If we get vaccination levels as high as we possibly can, we can put the pandemic behind us, at least to the extent that we can move forward with our lives in the expectation that COVID-19 will not disrupt our plans, rather than the fear it will. To help vaccination levels climb, as you've just heard, the mobile strategy led by Toronto Public Health and Toronto Health Partners provides the capacity to host as many as 200 mobile clinics every week. Person by person, arm by arm, these mobile clinics will help us move toward the high level of vaccination we know will give maximum protection to all of us and maximum peace of mind, too. Yesterday, we talked about schools and the importance of doing everything we can to support schools in their functioning and to stay on top of outbreaks in them. An ounce of prevention is always worth a pound of cure. So the most effective thing we can do in support of the school year is to get vaccinated. Infections have to come from someone. The more people who are vaccinated, the harder it is for COVID-19 to infect anyone else. We're doing well, but best protection is measured by delivering 2 doses of vaccine to all those who are eligible. We're getting there every day, but we have a ways to go from where we are to where we want and where we need to be. Narrowing the gap between the two makes a vital difference to our ability to bring COVID-19 under control. Every person in Toronto, every person everywhere is reliant on everyone else to get vaccinated in order to protect us, to protect our health, to protect our economy, and to protect our day-to-day lives. With that, I'll now hand the podium over to Councillor Cressy.
Well, thank you, Mayor Tory and Dr. de Villa. Today, I'd like to tell you a little bit more about our expanded Team Toronto mobile strategy. It represents the next phase in our efforts to break down every barrier, to build every bridge, and to reach everyone, everywhere in our city. Bringing vaccines directly to Torontonians, where you live and where you work, at your local school and your local library branch, at the mall where you shop, and the TTC station where you ride to work. Everywhere. Absolutely everywhere. Now, as of this morning, thus far, Torontonians have stepped up in this campaign. 83% of eligible residents have received their first shot. 83%. 76.6% are now fully vaccinated. 76.6%. And every single day, thousands of Torontonians continue to get their shots. It truly is remarkable progress. In fact, Toronto is now a world leader in vaccination rates. But, and listen, in this pandemic, there often is a but the higher our overall vaccination rate, the safer we'll all be. We have more work to do, and that's where our expanded Team Toronto mobile strategy comes in. Now, given all the talk of vaccines, I know it can seem hard to believe that some people who want a shot still haven't got one. But that's exactly what we're seeing. For many Torontonians, the issue remains access, not opposition to vaccines. While there may be some in our city who oppose vaccines, the vast majority of those yet to get a shot simply need some assistance. Many Torontonians still face barriers or questions that we're working to overcome, from mobility issues and language barriers to transportation access and technology challenges. Some people don't have an ID, and many frontline and staff and shift workers don't have the time. And for many, it's simply about information. People in our city continue to have questions, and they need answers from people and sources they trust. And so to break down these barriers, to answer these questions, our mobile strategy is bringing vaccines and the healthcare professionals who administer them directly to people. And I have to tell you, this strategy works. Let me tell you about our experience. Our homestretch push in the north and west of our city saw 11,667 doses delivered over 9 days at 41 hyperlocal clinics. That push represented a 35% weekly increase in vaccine uptake in those communities. Our targeted vaccine drive in the Taylor-Massey neighborhood saw 1,237 doses administered over 2 days at 9 local clinics, with an exceptional 28% of those first doses. And just last week, we saw similar success and results at pop-up clinics at TTC stations and local schools. As the mayor noted, 2 TTC station clinics saw 300 residents get their first shot. And on Sunday, just a couple days ago, we hosted a clinic at a school in the Jane and Finch neighborhood. 79 kids got vaccinated. 45 of them, 59%, got their first shot. Listen, in a city with 2.7 million people eligible for vaccines, 345 first doses at 2 small mobile clinics may not seem like a lot, but it's this type of relentless, local, and targeted on-the-ground work that will make all the difference. That's what the Team Toronto mobile strategy is doing. And so it's been a long 18 months. People are tired, people have suffered. Torontonians just want this all to be over. And it will end. We just need to keep working, we need to keep pushing, and we need to get our city vaccinated. With that, I'll turn the podium back over to Mayor Tory, and we'll answer any questions you may have. Thank you.
Questions for any of us, as you wish?
Thank you. We will now open the floor to questions. As a reminder, it's 1 question, 1 follow-up. Please unmute yourself before asking your question.
Hi, this is Melina Sheikh with City
First
News.
up, we have
Mayor Tory, my question for you is,
Sheikh from
are you
CTV.
concerned that the
Please go
provincial
ahead.
government's policy on vaccine certificates may only be a guideline for municipalities and leave it to each region to decide what to do?
Hi, Malia. Please ask your question.
Oh, Mayor Tory, can everyone hear me?
We can now, yes, thank you.
Oh, okay. So are you concerned that the provincial government's policy on vaccine certificates may only be a guideline for municipalities and leave it to each region to decide what to do?
I would think that is not the preferable approach. We've said throughout, I've said throughout, and I think many others have as well, medical officers of health and other mayors, that a province-wide approach is going to be something that is going to best fit the actual activities of people and the actual requirements of employers. Employers often have multiple places of employment, but the same policy would apply in different municipalities in different parts of the province. And the province is also the government that has the information on who's been vaccinated. It has responsibility for healthcare, education, and employment. And so I think the best answer is a provincial answer. Again, for the life of me, this is just a practical matter to allow people to have the information they need to work and to play and to live their lives. And I don't understand why there would be any hesitation to do so.
Thank you.
Next, we have Momin Qureshi from 680. Please
Hi, it's Francine Copen from the Toronto Star. I'm wondering, does this signal sort of the end of an era in the vaccination program? We're moving from mass vaccinations to something more targeted.
Well, I will start, and then maybe Dr. de Villa will pick up on that. The answer is yes. When you say the end of an era, it's really just an evolution that I think was bound to happen. And I've said often in our meetings that, very similar to sales campaigns that you have in the private sector that I oversaw many of and participated in, similar to fundraising campaigns you have for charities, there is a phase during which people will come forward almost on their own if you sort of just say, here's where the vaccinations can be given, and they'll show up and get it done. But as with human nature in many other areas, there are also people who it takes a bit more, persuasion, a bit more information. You have to make it a bit more accessible. There are issues such as those Councillor Cressy referred to, language and other things. And so it's just an evolution we expected would take place. We didn't know exactly when, but we moved as soon as we thought the time was right to transfer resources, people, mostly people, from the fixed clinics to the mobile strategy. And now we're wholly into the mobile approach, but with some of the clinics still remaining to look after those who find it easier to go to a place like that to get their vaccination.
So thanks, Mr. Mayor, and thanks, Francine, for the question. I think exactly as the Mayor pointed out, in other realms of human activity, the same thing applies in the practice of medicine and in public health medicine in particular. We are now at a different point in the campaign. At the start of the campaign, it was quite reasonable to take a mass immunization clinic approach. But now, with changing circumstances, we adjust our approach in keeping with those circumstances, very, very typical within the realm of the practice of medicine, and as you've heard, in other spheres of human life and activity overall. So I suppose you could call it the change in phase or the end of an era, but I think it's quite appropriate to the circumstances, all with the objective of making sure we are making it as easy as possible for people to actually get access to the protective benefit of vaccines, given our circumstances.
Follow-up?
I have a follow-up question, probably for Dr. de Villa. What does this mean in terms of the remaining mass immunization clinics that remain open today? And I'm not sure which ones are still open. Will they be closing soon, in days or in weeks? Do you have any sense of that?
So at this point, Francine, we do have 5 mass immunization clinics running at different points around the city, and I would encourage people to take a look at our website. They are continuing to function and are providing vaccines on a daily basis for those for whom that setting makes the most sense. What we're doing now in this campaign, as you've heard from the remarks delivered by Councillor Cressy and by Mayor Tory and myself, is that we are focusing our resources on what we're characterizing as a hyper-local strategy, very, very data-driven, very, very evidence-informed, and focused in a manner that we believe will actually help get those individuals who are yet to get vaccinated or who have yet to complete their vaccination series vaccinated as quickly as possible. The existing mass immunization clinics are part of that strategy and will continue to be there for some time yet to come. Of course, we hope that at some point in the not too distant future, as we work towards getting to the other side of this pandemic, we anticipate that at some point in the future, we will be able to, move beyond the realm of these clinics, and I think that will be a sign that we're on the other side of this pandemic. So we'll look forward to that day, and certainly getting us there faster will mean getting more and more people the protective benefit of vaccine.
Thank you.
Good morning, it's Momin Qureshi from 680 News. I'm not sure who can answer this question, but there are a percentage of people who are anti-vax, maybe who are the loudest, the people who refuse to get it, who spout conspiracy theories. But we know there are lots of people who don't get it for other reasons. And I just wanted to know if there's any data that you guys have where you know what that percentage is of people who haven't got it, maybe because of education, access, other reasons, or if you can talk about how big that number is of people who haven't got it, who aren't that group that appear to be the loudest, who refuse to get it.
So thanks for the question, Momin. I can say that in general, there is a significant body of literature in and around vaccine hesitancy. And our experience in Toronto has been such that there is actually a relatively small proportion of people who really have significant objection to vaccine in general. The vast majority of people who have yet to be reached at this point in the campaign, who are eligible but have yet to be reached, really are experiencing different kinds of challenges. There will be a small number that may have some medical reasons for which this particular vaccine is not an option for them. But the vast majority of people who have yet to receive vaccination but are technically eligible to receive vaccine have troubles with access, have issues with information, have issues with, just getting the opportunity, and some may have questions that they have yet to have answered. We know that based on the scientific literature on this subject, it is really important that we do our best, certainly as Toronto Public Health in concert with all of our city and health partners, that we provide opportunities for people to ask those questions and to have them answered honestly and earnestly. And that's what we're seeking to do. We also know, however, that having community leaders, people who they trust, sometimes healthcare providers with whom they have an existing relationship, or other community leaders, having honest and open conversation around what the concerns or questions might be is another very, very important mechanism by which to address, vaccine hesitancy and to facilitate access to vaccination. That's why we're enlisting the help of healthcare providers all over the city, community leaders, community ambassadors, people who live in these communities, who have trusted relationships and are known to people in these communities. This is, I think, the effort that we are putting all together to do the best we can to make sure that people have access to vaccine, are getting the protective benefit of vaccine, all with the objective of getting us to the other side of the pandemic as soon as we possibly can.
Great, thanks. And if I could just ask Mayor Tory a follow-up question as well. Just, Mayor Tory, in relation to Malia's question, if the province has come back and kind of lay it on municipalities to do the specifics of the vac certificate, do you think that's something that the GTHA mayors could kind of get together on their own and kind of come up with some sort of uniform idea or policy?
Well, we have weekly meetings, and we discussed yesterday, further ways in which we could cooperate in the context of a lot of different things, and we do that each and every week. And I'm not saying that, we can't cooperate to make things run more smoothly, but I am saying, and I have said consistently throughout, that a province-wide vaccination proof application of some kind is what is necessary here because of the mobility of people around the province for work and for other purposes, and because of the fact that you want to avoid confusion. What we need right now are things that are simple for people to understand and to use, because this whole episode, this pandemic episode, has been complicated enough and tough enough for people, and what we need now is simplicity. And that is going to be best delivered, I think, by province-wide application and by province-wide guidelines that speak to how that proof of vaccination application can work. And so I just think that is a far preferable way to go about it. But, I will say to you that the environment, and I think if you look at a statement we put out yesterday from the GTHA mayors and chairs, it was very much cooperative and willing and anxious to work with the province to make sure that all of this continues to work in the best interest of keeping people healthy and keeping things reopening on as steady a basis as possible, including and particularly starting with the schools.
Thank you. We have Mark McAllister from Global. Please go ahead. City. Please go ahead, Mark.
Sorry, I don't hear anyone calling on me. So, Mr. Mayor, it's Mark McAllister from City News. You no doubt remember years ago the intense debate that took place with regard to the east end of the Gardiner. Tonight is the night when that east end ramp is officially closed and will be permanently closed and torn down, and this will no doubt spark more debate, not only about the future of what happens down there, but just the disruption to traffic. So I'm just wondering if you could just speak to that and the fact that so many people will be disrupted as a result of not being able to get to and from the Gardiner as quickly and as easily as they currently can.
Well, first of all, had the entire Gardiner Expressway been taken down, the traffic disruption would have been monumentally worse than what is going to happen as a result of some construction that will happen on a temporary basis and the removal of this ramp. But let's look at the plus side of the removal of this ramp, which will provide for easier access to the waterfront. It will help us in our flood protection efforts. It will allow for some construction that will happen to create pedestrian, cycling, and even a linear park. So there's a lot of benefits that will come from this as part of the overall agreed upon redevelopment of the Gardiner Expressway. The expressway itself, in due course, will be moved, as people probably know, much closer to the train tracks so as to free up access to waterfront land and make it more open in that area. This is a discussion and a decision that was taken by the City Council a number of years ago. The planning and design work has continued during the time between, and now we're proceeding to do the work. And I think if there was anything that was a hallmark of past administrations in the city, it was the fact that decisions would never be taken and work would never begin on things. This is something that was agreed upon by quite a handsome vote at the City Council, and it's now proceeding to do the work. And I certainly don't take any joy from disruption that's caused by any kind of work. We have a huge amount of construction going on this year in the city. But let's remember, This is the fastest growing, or if it's not, it's one of the top 2 or 3 fastest growing cities in all of North America. I'm proud of that because it means people from around the world are choosing Toronto. People from this country and this continent are choosing Toronto to come and build our economy and build up one of the world's most livable cities. And so we have to keep up with that in terms of the transportation infrastructure and all the transit we're building, the housing that we're moving forward with, thousands upon thousands of units, and all of that, including just even plain old resurfacing of roads and removal of potholes, causes traffic problems. But to me, the alternative of not doing the work is way worse. And so we have to do this work, and we try to do it in a way that is as considerate as possible of the need to keep everybody moving and safe. And that includes not just drivers, but pedestrians, cyclists, and others. I will tell you that an immense amount of time has been spent at the city by officials and by Waterfront Corporation, which is actually the sponsor of this project, making sure that we can just keep everybody moving and keep everybody safe. And that includes everything from alternate routes to signal timing to different things that are going to be done to accomplish that objective. And that's what we'll do. But this work, any kind of work around the city where you see the pylons up and the signs up, it's not because we're trying to deliberately make lives difficult for people. It's because this work has to be done in the interest of building a livable city that can be a safe and healthy place for everybody.
Thank you very much.
Great. Thank you so much. This concludes our press conference. Have a great day.